so I check the orders, see that the patient needs a Foley catheter. I grab the supplies. I then knock, provide hand care. Hi, my name is Deacon Leonard, and I will be your nurse today. Can I get your name and date of birth? Alrighty. So today we are going to be inserting an indwelling catheter. You've been experiencing some urinary retention, so we're going to try to counteract that. Is that alright? She said yes. Okay, so now I put some gloves on. I pulled her sheet back so I can access the peri area. I then provide peri care and make sure that it's all nice and clean and really dry. Then I provide some privacy while I'm getting my supplies all around. So I grab the catheter, I open it up without crossing. Alrighty. So then I grab this. I can touch the shiny side, I can't touch the other side. And then move that up. I get this under her. Alright, and then I grab the other sheet. You can use it to provide privacy for the peri area, but with the females you don't really have to. The males you do, but I'm just going to use it as some more extra sterile field. Then you grab the gloves without touching anything in the box. Alright. Okay. Alrighty. So then I get this here out of the box and I start getting everything around. I put the iodine on the cotton balls. Then I discard that. I put some lube in the tray. And then discard that. And then I start getting the catheter ready. So take the tip off. Attach it to the catheter. And then unsheath this. And discard that. And then I just make sure that I dip this into lube and you can let it stay there. And then alright. I also make sure that I check my balloon to make sure that it fills and whatnot. Okay, so now it's time to clean. Alright, once I touch the patient with this hand, it's not sterile anymore. So then I open up so I can see the urinary meatus. And swipe and discard. Swipe, discard. Down the middle. One more. And swipe. Alrighty, and discard that. Alrighty. And then I'm ready to to insert the catheter. So for the females, you insert 3 to 5 inches, and then once you see a flash of urine, then you further that 1 to 2 more inches, and then you you inflate the balloon, and then you give it a little tug until you feel resistance, and then you disengage that. Alrighty, and then you take your gloves off, and then you discard them, and then you put new gloves on, so then you can undo this. After you tape the catheter to the patient's leg, or you use something to keep it there, and then you attach the catheter bag to the patient's bed frame, not the side rail, and clip the excess tubing to the patient's bed. Okay, so to get a urine specimen, you would use an alcohol pad, wipe down the port, take a syringe, lock it on there after clamping the tubing, and you take your specimen and empty it into the specimen cup, however many milliliters, and then after you're done, you wipe it off again with the alcohol pad. To irrigate it, you would again clamp it off, and then use another syringe full of saline and squirt it in there. And then to remove the catheter, you'd put gloves back on. You'd take your syringe and stick it in there and pull all the water out. Okay. And then you'd have the patient take a deep breath, and when they exhale, you pull it out. And then, make sure that they're nice and comfortable, and they have the crawl bell and everything.